Hi, I'm Dr. Tanner of the Goldberg Tanner Clinic, where we focus on reversing chronic disease with our patients. And I'd like to share a conversation I had with a patient recently. It's actually a topic that comes up fairly regularly with the patients we work with, and it's an important one. And it has to do with how medical science and medical statistics can often be misleading. Now, this patient came in to see us. She had had breast cancer, and she had already received medical treatment. She had surgery to remove the tumor. She came in to work with us because she wanted us to help her identify factors that may have led to the cancer in the first place so we could address them directly and improve her biochemistry and thereby reducing the risk of recurrence. And we've been working with her in that fashion. She's been doing well. But she recently came in and she told us about a follow-up visit she had with her oncologist. And her oncologist was suggesting that she take a form of immunotherapy called Nerlynx. This is a drug. And the drug is advertised by the pharmaceutical companies. You can see it online. It's reported to reduce the risk of recurrence of breast cancer by about 40%. And this is what her doctor told her as well. And when she came in, she said, "Doc, I just wanted to get your opinion. What do you think about that?" And I said, well, 40% is a fairly substantial, reduction in risk of recurrence if it's true. But you have to weigh that against the risks, the potential side effects versus the potential benefits. You want to do that with anything that's suggested to you by a healthcare practitioner. And I said, well, why don't we take a closer look at this? I know you're considering it, but you want to make sure that you're fully informed about the statistics and the potential risks and benefits before you make a decision. All right, now before I go further, there's a couple things you want to be aware of, a couple terms as we kind of dive into this. That one of them is what's called relative benefit, and the other one's called absolute benefit. These are terms that are often used in medical statistics to report benefits to a patient with respect to a certain treatment, in this case, a drug. The relative benefit is a percent difference between two groups. The absolute benefit is just as it sounds. It's the absolute difference between two groups in terms of a benefit from taking a particular treatment. So let me give you an example of how that works. So let's say my risk of dying of a heart attack was 2%, say 2 out of 100, and there were a drug that would reduce my risk to 1 out of 100 or 1%. All right, in relative terms, the difference is a 50% reduction. So if I took that drug, it would reduce my risk by 50% from 2 to 1, because 1 is half of 2. That's the relative difference. The absolute difference is 2 minus 1, which is 1. So, so the statistic that's often reported medically is not the absolute difference, but rather the relative difference. And you can see how that can be misleading. So the drug would be advertised as saying, hey, this drug will reduce your risk by heart attack by 50%, when in actuality, it only reduces your risk by 1%. So it's just kind of the clever manipulation of statistics to lead a patient into believing that the drug is more effective than it actually is. This is what happened with this drug called Nerlynx that we looked into a little more closely with the patient. I actually went on the drug's website and was able to download a brochure for the drug. It was actually a frequently asked questions document, and I'll show that on the screen here. And as you can see, if you go down to the section where it says how effective is Nerlynx, that there is in fact a substantial reduction in risk for recurrence of breast cancer when taking the drug. But the question is, was that relative benefit or was that absolute benefit? And in reading the statistics, I'll read them to you right now. And it says, in a clinical trial, Nerlynx reduced the risk of cancer returning by 34% at 2 years. And it also, and there was a 42% reduction in the risk of recurrence at 5 years. Now, what they fail to tell you, at least right up front anyway, is that these are relative terms, relative statistics. If you go down a little further, you'll see in the fine print at the bottom, which most people don't look at or wouldn't know how to interpret, it says these are relative benefits. In absolute numbers, 94.2% of all people studied who took Nerlynx had no return of cancer after 2 years, compared to 91.9% of people on a placebo who had no return of cancer. So if you look at that more closely, let's get this straight. If you took the drug, 94% of the time approximately, the person would have no return of cancer. If you didn't take the drug, about 92% of those people had no return of cancer. So the absolute difference between groups was only about 2%. And then at the 5-year mark, 90% of people who took the drug had no return of cancer, compared to 85.7% of people on placebo who had no return of cancer. So the absolute difference at the 5-year mark was only about 5%. That's a dramatic difference between what's actually reported by her physician to the patient and also what's reported in the advertisements by pharma. They'll tell you 40% reduction in risk of recurrence. Again, they don't tell you that's the relative benefit, not the absolute benefit. So again, you can see how this can be misleading. The patient is then left to make a decision not being fully informed of the actual data, the absolute data. And this doesn't just apply to this particular medication. This is done in other medical statistics as well. I could show examples of how this is done with drugs like statin medications, which are used to lower cholesterol and are advertised to reduce the risk of heart attack and stroke. So when a doctor presents you with an option for a treatment, in this case a drug, you want to ask not only about the relative benefits, because that's generally what they'll report to you. You want to say, hey, doc, can I see the absolute data? Can I see the absolute difference in groups between the people who took the drug and the people who didn't take the drug? Because what you'll often see is a very different story from the relative to the absolute statistics. So it's important that you're aware of this as the patient so you can be fully informed and make a decision that you're comfortable with. I don't tell people to take drugs, not take drugs, and I'm not making a case for whether the patient should take Nerlynx or not. We just want the patient to be fully informed of the potential risks and the absolute benefits so they can make a decision they're comfortable with having all the data at hand.